Hello everyone, welcome to another episode of Simply Healed, and with me today is Dr. Jansen.
Hello everyone, hello Shan, glad to be here again, and welcome to our webinar tonight.
And tonight's episode is a special one. I want you, all those who are here tonight, I want you to share this with all your friends and family because tonight we're going to definitively answer what is eczema and psoriasis and why are your loved ones and friends suffering from this. So please share it with your friends and family who are suffering from eczema and psoriasis, because this patients who suffer from eczema and psoriasis, doc, it's not just the physical pain that they go through. There's a lot of emotional turmoil.
Yeah.
And imagine, if you're a lady and you can't wear sleeveless, your hands, you may have to wear gloves because there's pus.
Yeah.
It destroys their self-esteem, their confidence, it leads to depression.
Yeah, they can also be bullied.
They can be bullied. Yeah, kids are so mean.
Mm-hmm.
If your daughter has eczema, people say, disease. They'll be made fun of. Oh, it's terrible.
It's really sad.
It's really terrible. And let's flash this up on screen right now. We start this very special episode. So to everyone, please bookmark this video so that if you ever meet anyone who has eczema and psoriasis, show them this video, you will change their life, all right? Because tonight we're gonna definitively discuss what it is and that it can be solved. But let's start with this bold statement by Mayo Clinic, one of the most famous clinics in the world. It says here, this article was actually written in 2011.
Yeah.
That was 10 years ago. It says steroids have been used for 50 years, so it's 60 years now because it's 2022. And it's amazing because it's really not a cure.
Yeah, it just solves, it's a short-term solution. So it just solves the superficial problem and not the underlying one.
Doc, you mentioned that you've seen people who use steroids for a long time.
Yeah.
Even when you were as early as when you were a med student.
Yes.
Yeah, maybe you could share what you saw.
Yeah, so there was this lady who came to us. This lady actually has Cushing syndrome. Okay, so back then, I was a student. Our professor was trying to teach us how to interview, try to discuss what Cushing syndrome is. So basically, what Cushing syndrome is, the person has a buffalo hump.
Wow,
The person has a moon phasie, obese.
Wow.
That patient of ours also has diabetes and osteoporosis. Okay, so and probably has coronary artery disease as well. Now, this lady, this patient of ours, was already on 30 years of steroids.
30 years of steroids.
30 years. Yeah, it's because of the arthritis, because of the skin disease that she has. That's why she has to take. She has to be on steroids for a very, very, very long time. And one of the major side effects of long-term steroid use is, Cushing syndrome.
And Doc, it's not just oral steroids, right? When you use steroid creams, it actually enters the bloodstream.
Yeah, it can. Yeah. Right. Okay. So anything that you put on the skin, especially the topical medications, it can actually be absorbed through the skin.
And it thins out your skin.
Yeah,
it thins out your skin.
Thin out your skin as well. That's one of the side effects of steroids.
And also, topical steroids are not advised to be used on the face. Mm-hmm. Right, which is a big issue for patients who have eczema and psoriasis. What is psoriasis and eczema? Isn't it a skin disease like like any skin disease, like a mosquito bite? We take an ointment and we apply.
Right. Okay. Now let's go for psoriasis first. Okay, let's discuss psoriasis first. Psoriasis is actually an autoimmune disease. So by autoimmune, it means that your immune system attacks your skin. Okay, that's why you have that scaling, that plaque on your skin, which is what we call psoriasis. Okay, so that is basically what psoriasis is. So how do you then tone down your immune system? It's very important that you eat a plant-based diet because the plant-based diet has high antioxidants. Now, if what you're eating has high antioxidants, then it will tone down the immune system, or it will tone down the inflammation that is caused by the overactive immune system. Okay, so what you need are immunomodulators, food that has immunomodulator properties. Okay, so that is what psoriasis is. Now, eczema has is tied very closely to psoriasis. Now, psoriasis is an autoimmune disease. Your immune system attacks your skin. Eczema is a different one. Eczema is an overactive immune system with a lot of inflammation. That's why your skin has a lot of redness. Okay? That is a manifestation.
So it doesn't attack the skin per se like psoriasis. That's why you don't see the severe flaking of psoriasis.
It is hyperinflammation. Yeah, okay? So that's the difference.
So Doc, there's also this term not so familiar in Philippines but elsewhere in the world, and we have international viewers, like for example in Taiwan. They don't say eczema or psoriasis, they say AD.
Yeah, AD, atopic dermatitis. Yeah. So eczema is a general term. It's an psoriasis is an eczema. Atopic dermatitis is an eczema. Okay. So, but with these classifications, each disease actually has similar root problem, which is the immune system, an overactive immune system. So why do dermatologists prescribe steroid creams? It's because steroid creams suppresses the immune system. If it suppresses your immune system, the inflammation would be not that bad. And if the inflammation is not that bad, then you won't have the symptoms that you're feeling will decrease. Okay? Now, the problem is with steroids or steroid creams is you cannot use them for a very long time. The limit is 14 days. After 14 days, you have to rest your skin, then apply it again. But the problem is, if you don't address the root problem,
it gets worse and worse over time.
It just comes back. It gets worse over time. If not, if you improve, well and good, but it will come back. Okay? If you don't address the root problem.
So how do we address the root problem? To address the root problem for eczema and psoriasis is not to focus on the skin.
Yeah, you have to focus on the inflammation that is caused by your overactive immune system.
So at the end of the day, we cannot just even, if we target inflammation, again, it will be like applying cream. Because the inflammation is actually caused by the root cause, which is something is off with the immune system. If we don't put the immune system back, you will forever be dependent on the crutch. You need to manage your inflammation, you need to manage your skin antihistamines, right? So the thing is still immune system.
Yeah, so you have to have a smart immune system, okay?
So to all the eczema and psoriatic patients listening into this program right now, you're not looking for an immune system booster. And most of your treatments right now is a temporary immune suppressant, right? Just like antihistamines. So what you're looking for, the solution is an immunomodulator, right? Get that word into your heart. You can Google it, search it. It's basically to make sure that your immune system works normally.
Yeah, so
not hyper and not hypo.
Not hypo, yeah. Because if your immune system is suppressed, immune system so low, you'll be prone to infection. You can die from infection, of course, you know. Yeah. And if your immune system is hyperactive, then you have those flare-ups.
Eczema and those flare-ups.
So you need to be somewhere in between. You need your immune system to function the way it's supposed to be if you have an infection, and at the same time, if you don't have an infection, if you don't need the immune system, the immune system should be toned down. Okay, so it has to be.
So what we need a smart immune system. What treatment are you looking for? You're looking for a treatment that affects it's an immunomodulator. It modulates your immune system. Yeah. So what would you recommend as immunomodulators? Or how do you bring your crazy immune system, which is too hyper, which is why eczema and psoriasis, how do you bring it back to a normal, sane working condition?
Okay, so number one is for you to eat a lot of antioxidants. So plant foods, again, okay? Number two is Simply Nature Pea-Pars, because Simply Nature Pea-Pars or the microalgae is an immunomodulator in itself.
Wow, okay? It's not just an anti-inflammatory, it's not anti-inflammation, it's not an immune booster only, it is an immunomodulator.
Yes, so if you feel a lot of these flare-ups, meaning you have a lot of inflammation inside your body, you can actually take Simply Nature Pea-Pars to lower or to tone down the inflammation. Okay?
And to all our viewers out there, for me, this particular topic is actually personal because my wife suffers from eczema. All right, and after taking Simply Nature Pea-Par tablets for a period of a month or so, she started to see other improvements in her body first, which is like her menstrual cramps and everything. But for her eczema, it took about 3 months. Right? She loves to eat prawns, and every time she eats prawns, and if she eats crabs, for sure there will be an outbreak. All right. Even though she's taking Simply Nature PPARs, if she takes crabs, the redness will come.
Yeah.
But you know what's so amazing? The amazing thing is that the next day, her redness will disappear. So it will come down on its own. And this is what Doc Jansen is talking about. So to all the eczema and psoriatic patients out there, I know you've tried many remedies. They have not worked, or they worked temporarily. You got well, but then the eczema came back. And the reason Doc clearly said is because you took a very effective anti-inflammatory, all right? So you don't see a redness. You may have taken something that was a very good antihistamine. It blocked the reaction, which is why your eczema subsided. But then it always came back. Why? The root cause, your immune system, was never modulated. But for my wife, it restored, the PPAR tablets restored her body's ability to modulate its immune system, for the immune system to function normally. So that even when she takes things that trigger her immune system, it could normalize itself within a very short amount of time. And of course, if you take the soft gels or extracts, then you will see the subsiding of all these symptoms very quickly as well. But here's really the thing. Over a longer period of time, 3 months and above, you will actually see that the immune system is modulated, is corrected. You know, Doc, cases worse than my wife. Look at these psoriatic pictures here. These are 3 months. 3 months mono protocol. They weren't using much of anything else, just PPAR tablets. Look at this guy, psoriatic. The skin is all scaling. It's all became normal. The skin got to recover. And this is very encouraging. I want all the eczema and psoriatic patients to know that this is not something you apply on the skin, right? We are taking it orally, goes in, modulates our immune system, and the result is on your skin. It's so different from everything that you tried for the 2 decades, applying all sorts of ailments on your skin. Now, this is something you take to make right permanently, long-term, your immune response, to modulate it, and this is the result.
Okay, yeah, so point number 2, again, don't eat the things that you should not be eating.
Don't trigger.
That is seafoods, eggs, chicken, dairy products, on some degree chocolates as well. Okay, but our chocolates are actually with dairy already.
Yeah,
so
that's why.
That's why people who eat milk
Dark
chocolate,
chocolate.
yeah, dark chocolate.
Dark chocolate is
better,
fine. My wife takes dark
better
chocolate,
one.
it doesn't trigger her.
Yeah, dark chocolate is a better option than milk chocolate or white chocolate. Okay, so but remember the triggers: eggs, dairy products, seafood, chicken. Okay, those 4. Okay, now let's go to number 3. Number 3 is a high fiber diet. Why? Your probiotics or your gut health or your gut microbiome has a big influence on modulating your immune system. Okay, it has a direct influence on the manifestation of AD. Okay,
Wow.
so how does it work? So with a high fiber diet, so fiber is basically prebiotics. Okay?
Yeah, it's what your good biotics eat.
Yeah, that's
keep healthy.
yeah, correct. Okay, so that is what your bacteria or your gut microbiome eat. Okay, the fiber. So Cleansing Plus is a fiber supplement. So now, when the gut microbiome eats these or metabolizes the prebiotics or the fiber, they secrete short chain fatty acids or butyrate. Okay, so the butyrate is the one that modulates the immune system. Mind you, not just atopic dermatitis, asthma as well. Okay, so for those of you who have asthma, most likely you have. If you have atopic dermatitis, you'll most likely also have asthma. So that can the asthma can also be modulated by a high fiber diet. Okay, and number 3, you have to apply something on your skin. Of course, you have wound. Okay, wound from scratching, abrasions. Okay, so it would be better if during the days that you're off steroids, put in a probiotic serum.
And we have that in Simply Nature. In fact, actually, Doc is the first in the world right now that we know of, therapeutic level of probiotic for the skin. So it's not like those probiotic that you see, probiotic that you see in cosmetics, like moisturizer with probiotics. That is just to keep your skin moisturized. This is probiotics specifically designed to curb the Staphylococcus count. So what that is, Staphylococcus is the bacteria that's responsible for the redness and for the infection, right? And you can see from this chart, every time you, the eczema and psoriatic patient, has a flare-up, look at the type of bacteria that's on your skin. Your whole skin is basically covered with Staphylococcus, and that crowds out all the good bacteria, and that makes healing very difficult. And if healing is difficult, you start to itch, you scratch, more infection, and until sometime your skin really gets damaged, that its ability to heal is actually compromised. And that's where you have permanent scarring and the scaling in your joints and your fringes of your scalp and so on. And that is the vicious cycle, Doc.
Yes.
So we have a solution. You take the Simply Nature PIPA protocol to modulate your immune system, but that takes time. That takes time. As we saw in our work with the Center for Disease Control, CDC in Taiwan, it took 3 months. So in between the 3 months, you're still going to have your flare-ups.
Yeah.
And then you need something. So instead of putting a steroid cream that again damages inside, put a AD Pro, which is a probiotic to help the breakout come down. How fast does it work? It literally works within 15 minutes. When my wife has a flare, she applies the AD Pro. Within 15 minutes, the redness, the swelling goes down. Doc, in fact, your brother has tried AD Pro.
Yeah, my brother has tried AD Pro. It immediately reduced the redness in the scaling.
He has eczema?
Yeah, at his nape area.
The nape area. It's really interesting. I mean, for those of you who don't have eczema, it's you won't understand. But some eczema patients here is on the fingers, some is on the nape, others is on the T-zones. It's really something very frustrating.
Yeah.
And if any eczema patient says, I don't care, it's okay. It's not because you don't care, it's okay. It's because you've tried so many things that you've learned not to care.
Yeah.
It's like, okay, I'm not handsome, so I have to learn to deal with it, right? But if you could be like Cinderella, if the fairy godmother comes and can transform you, you would not say that you don't care. So tonight, start caring again, because whatever condition that you may have, your eczema and psoriasis, we can make very good advances in it. And Doc, any last point before I want to also quickly move the AMA, because Doc, I can see people are asking lots of questions about it.
So probably we can just give them a summary, So as a summary of the treatment protocol. So how do you approach eczema and psoriasis? Go on a plant-based diet. Avoid eating the foods that can trigger these. Cleansing Plus, PPARS Plus tablets, AD Pro. So those are the solution.
Addressing the immunomodulator. You got to have immunomodulators. So not just antihistamines, not anti-inflammatories. Those are temporary. That's why your eczema keeps coming back again and again. Now let me before we go to our AMA, Ask Me Anything, I want to share one of the most severe cases by one of our own doctors here in the Philippines. So one of our doctors prescribes soft gel capsules for psoriatic patients, and she buys a lot of it, and a lot of it is actually for her own sister, right? So her sister has had psoriasis for so many years, and it's so bad that every 6 months or so, she has to have injections injected into her joints. Oh, wow. So those of you whose psoriasis is not that serious, if you ignore and don't do anything, and if your immune system goes even more out of whack, you're going to have psoriatic arthritis.
Psoriatic arthritis.
That's so painful.
Yeah.
And can you imagine every 3 months taking a needle, injecting into your knee and your joints? So she really felt for her sister, and she put her sister on soft gel capsule. So after she did that, after 3 months, 6 months, I think they went for one final jab, all right? And then after that, no more injections to the joints. Wow, that's fantastic. And her sister is total body psoriasis, right? It's not just the fringe of your scalp. So this really, really helped her. Is she still suffering from psoriasis, yeah, there are still psoriatic symptoms because this has been a 20-30 year disease, and she was so serious. She was using all these strong medication, injecting already. So that healing process takes a longer time. However, she's no longer having to inject into her joints, and that in itself is such a wonderful progress. All right. So with that last example and success testimony, let's move to our AMA, where we can see there are lots of questions about psoriasis and eczema.